you all probably know folks that have it now.
Well, for the third year in a row, as we head to school starting this fall, we're talking once again about COVID-19 in Cobb County. It seems like it will never end. I'm here at Cobb and Douglas Public Health to talk to its director, Dr. Janet Memark. This time we have more than COVID, though, to talk about. But let's start with the latest.
Right now what we're seeing is some of you have seen that we are in high transmission once again, and it's a little bit different of a criteria. We don't have that 100 over 100,000 like we used to. Now there's looking at the transmission rates as well as looking at hospitalization. So we've entered into, and this has been a few weeks now, so we have some pretty significant transmission, and then we also have an increase in hospitalizations. Now it's not even close to where it was when we were in Omicron and Delta back in the summer and the winter. So that's good news, right? And it's a gross underestimate of numbers right now because we have a lot of home tests and people are doing other things. So it's you all probably know folks that have it now, especially folks that come back from traveling. I'm hearing a lot of people that have gotten it from there. And so we continue to be in high transmission. What does that mean for us? You're probably going to ask me next, right? So main things, most important things are really making sure that you are boosted up and you are vaccinated up. And so you are eligible after the age of 50 for your second booster shot. And so it's important to go ahead and get that. And if you're immunocompromised, you might be able to even get that third shot, right? And if you were 6 months or over, you are eligible for the first booster shot, 6 months to 49 years old. So just making sure, I've met a lot of people that have gotten COVID that did not get their shots updated. So this would be a good time to do that. And if you're sick, if you come up down with something, you know, the sore throat and the cough and the usual stuff that we're seeing, please, it is not an allergy and it is not a summer cold right now. When we hit high transmission, it's freely going around. So it's most likely COVID. So just go ahead and hunker down for a little bit and do what you need to do, and then you should be back into action once again. So just remember your mindset. Make sure you kind of wear your mask out in public places and make sure your boosters are up. So one of the other questions I'm going to ask my own questions today. I'm going to answer them today. Is what should we do, right? So you know, definitely. So if you catch COVID this time, right? The good thing with BA.5, which is this mutant that we're seeing now, is that it is not any more severe than any of the other variants. Now it is the most transmissible of all of them. Very, very infectious. So it's very easy to pass it amongst folks. Now, the timing right now, so the problem with this one also is that it also can evade the vaccine, and it can also evade your natural immunity. So people that had COVID just a few months ago are getting reinfected. That it kind of sucks. It's not like light infections. I mean, it's a pretty, you know, good infection that I'm seeing that it could easily go into a secondary bacterial infection or something like that. And so it's important to go ahead and if you are coming down with it and you're a higher risk person, so you're elderly, maybe over the age of 60, or you have any lung conditions or immunocompromising conditions, we have medicines available. And I want to make sure that you all know that. And so you can call your doctor and they can call in these prescriptions. And we have it on our website that there are several pharmacies throughout the county that have the medications that are available to you to help to decrease hospitalization and death. So it's important that if you're outside of a window where your booster is working, that you go ahead and do something like that. Okay. If you don't have a doctor, which a lot of people may not have, we have on our website there are these test to treat options, and so you can go ahead and get tested at the location, and then they will prescribe the medication for you and provide it there. All right, so I just want to make sure that everybody understood we're kind of in this strange window, like that you could get infected even though you had it or that you got vaccinated. And so if you end up being pretty sick, there's some options to help you out here so that we can try to prevent hospitalization and death.
So you mentioned that we seem to be in a high transmission rate, and it's probably even underreported. In the past 2 weeks, I've had a son-in-law, daughter, 2 neighbors, a coworker, and a friend who've all come down with COVID. Now, 5 of the 6, it was like a week-long bad cold, light flu kind of thing, but the 6th person got hit pretty hard. But I think the general feeling in the public is this isn't that much to worry about.
And the good thing is that we're hoping that it isn't really severe, right? And so most people are going to do fine. So it's those higher risk people that, we just want to watch out for. Hospitalizations that we've seen have been people like more over 70 years old. So we're back to the beginning where we want to protect those folks. But most of us will do fine, and that's great. So, we have come a long distance. So we've had this, like, how many waves have we had? So
you've already touched on this. So you've kind of been asking and answering your own questions, but kids are going back to school. Parents, I know, are just tired of this completely. But what would you advise parents when their kids head back?
So, there's a couple things. So the kids are eligible for their vaccines and boosters. So just make sure that you got them, all vaccinated and boosted up. You're going back during high transmission. I think last time we were at much lower transmission, and so, it was a little bit less stress sending kids back. But when you're going back in high transmission, you just want to make sure that, you're protecting people as best you can. The other thing is, it's not just your COVID vaccines. Make sure you have your other vaccinations up to par as well. And so we are seeing that we have seen our first case of polio, I think, in the United States in a long time. So these are, dead viruses and that are coming back to get us. So, we have vaccines that work and protect your kids and us from all of that. So I would suggest making sure that you are fully up to date on your shots before you go back. And if if your kid hasn't had COVID yet and is probably a higher risk, just make sure they're masked up, and I think that will help.
Are you helping getting the immunization to kids?
Yeah, so we have a couple of back to school events that are coming up, and I wanted to make sure that you knew about them. You can check on our website as well. But this Saturday we have two events. So one here in Marietta in the morning, where you can actually get your vaccines, any of your school vaccines, your COVID vaccine. You can get hearing and vision and dental screenings as well. So from 8 to 12 at the Marietta office, you can come do that. You can call for an appointment. And then in Douglas County, if you live there or close to there, you can go to that health department as well, 8 to 12, and the same screening. So vaccines, all your vaccines, hearing, vision, and dental. If you don't have insurance, then we can provide them to you anyway.
So here at Cobb and Douglas Public Health, what have you seen when it comes to questions from the public about COVID? Has it died way down, or is there still a lot of concern?
I think the questions have gone down a whole lot, and so we are definitely in a better place. I think it's just mostly fatigue. We are all fatigued by this. So that's why I try to get some newer information to you all. People don't seem to know about the treatments as well, and I just want to make sure, because right now treatments might be important because, the vaccine, you might have already gotten boosted and you may get sick. So go ahead and really consider getting treatment at this point.
And on top of all this, we have the ominous sounding monkeypox that is making a lot of news, including, I think, the first case of monkeypox in a female in the state of Georgia. Is that something we need to be concerned about?
Yeah, so we have another international declaration, right, from the World Health Organization. That happened this weekend for monkeypox. Monkeypox has been around for a long time, and so the first human case was like in 1970. Previously, it was always associated with travel. So travel to Africa or like contact with monkeys. And we have seen, in some of this where, you were playing with monkeys in Africa, you're allowed to do that. It's much more common than here, and cases would pop up. So the question I get from people is, what is happening? Why is this happening now? And it's a virus, so viruses have a chance to mutate. And so this virus may have mutated so that it has much more effective human transmission now, right? So that's one of the things. There is a question of maybe the smallpox vaccine, that smallpox is it's in the same family as monkeypox. And so maybe when we were giving smallpox vaccines, that gave some protection, and we stopped doing that in like 1970s. And so maybe we don't have that immunity as well. So once again, we have no immunity, and now we have an effective mode of transmission. Should we worry? So some of you have heard that we have almost 3,600 cases in Georgia right now. You saw our first female case was identified yesterday. Now, the majority of folks that are being infected right now are identifying as folks that are gay or have sex with men, right? Men who have sex with men. And so you may say to yourself, oh, I'm in the clear, right? And so I just want to, kind of caution folks about that, right? So, this is not identified as a sexually transmitted disease. It's not, that's not the pure classification of it. And so right now it is being transmitted that way, but the contacts that we have had, and we've had children that have had, some contact with folks that were positive, that are coming back positive. And so the rashes don't always come up in your genital area. People will get them on their face, on their hands, legs, and those lesions are infectious. And so it can spread outside of this group. And so that's why right now the federal government and state governments have been trying to go ahead and vaccinate the most high risk so that we can try to make sure it doesn't spread to the wider population faster and faster. So that's what we're working on right now, is going ahead and vaccinating those folks. But I just would be cautious. We all want to kind of make sure that we're all on the same page about this, and making sure that we get people treated and vaccinated and isolated so we don't get it spreading to other folks.
So I've seen the pictures of the lesions, but are there any other symptoms that we should look out for when it comes to monkeypox?
Yeah, so that's a great question. So monkeypox, unfortunately, sounds very much like a lot of the other viral illnesses, right? You can get a fever, a rash is very, very common. You can get lymphadenopathy, you can get fatigue with it as well. The main thing, and muscle aching. The main thing with monkeypox is those lesions, and please, if you get a chance to take a look at it, it's like a pearly, blistery lesion. And then they will scab over, and then they will fall off. You are contagious when that first pimple shows up until it scabs over and new skin is there underneath. And that can be 2 to 4 weeks. And so you must isolate if you have it. You can ask your doctor to get tested, or you can call public health. But now it's in commercial labs, so you can get tested for it. Should everybody get tested? Well, if you were, in a situation where you were in contact with somebody that might have been higher risk, and then you developed the lesions, or if you had some contact with somebody that had monkeypox and then you develop the symptoms, then definitely you should get tested for it. But we should have more availability for testing. So if you have those lesions, please isolate, right? It's similar to COVID. It's not as easily spread respiratory-wise, but it can be spread that way. But it can spread on things, and that's what is a little bit concerning about monkeypox as well. Bed sheets, towels, and so you have to isolate yourself and don't be hanging around with folks. Even your pets, if they get to the lesions, they can be vectors at that point. So please make sure that you isolate.
Can it be deadly?
It can be deadly, but the great thing is it's a very low percentage of folks that are dying from it. It's usually immunocompromised, but apparently it's a pretty painful lesion, and it can be pretty contagious.
So the high-risk groups are being vaccinated, but I heard we're not to the point where we can really go and vaccinate people beyond that at this point.
Yeah, so the vaccines are limited at this point, and so they're entering their phase 3 of the vaccines. And so, by the end of this year and next year, we should have millions of vaccines that are available to cover all high-risk folks. But right now, we're doing people who have been exposed, the close contacts, and then folks that are higher risk at this point.
So I'm going to ask you a question I have no idea if you have an answer about, but you and I have always sat here and talked about COVID primarily and other infectious diseases, but I know Cobb and Douglas Public Health has an outreach campaign going on now about the rise of fentanyl in the county. And, I recently was at a talk where it was expressed that this has become a large problem in the county, and we've had deaths and a lot of hospitalizations because of fentanyl. So what role do you all play in that?
Yeah, so that's a great question. And so one of the big roles that we play is just the kind of the data kind of collection role. And so we end up being some of the first people that get alerted when there's some clusters and issues. We've all grown up with drug epidemics, right? When I grew up, we had the Say No to Drugs campaign when I was growing up. And so I guess a question kind of comes up is, how is this different, right? So, one of the things that's really quite concerning about this is, first of all, it's fentanyl. Fentanyl is a drug that is synthetically made, and it's like 50 times more potent than heroin is. And what is really truly frightening is that it takes less than the amount that goes on the tip of a pencil lead to kill somebody. So that's one thing. So it is not being cut in and distributed from pharmaceutical labs. You have somebody in some abandoned building that is, making these drugs. So it is very easy to get, too much fentanyl put into anything. The second thing is what we're finding is a large number of folks that are getting it when they think they're getting something else. So you're in marijuana, in your ADHD meds, in other, benzodiazepines. And so it's very, very unfortunate, but people think, oh, well, I'm getting I'm just getting, ADHD medication, and then it could have fentanyl in it. And so I caution everybody. So first of all, we should not be taking drugs that are not prescribed from your doctor. But be very careful. If you're getting it from friends or from family, one thing, you shouldn't be doing that if it's prescribed by a doctor. But you don't know if they're having it delivered under a doormat at their house, right? Because people traditionally haven't been scared of ADHD meds, right? But now you can get it, and you can get illegally made medication and have that delivered, and it be contaminated with fentanyl. And so I warn, I have a 12 and 14-year-old, and I've had this discussion with them because I'm truly frightened. I said, please do not take anything. If someone says to you, this will help you concentrate or this will help you relax, do not take this medication, because we don't know if it maybe has fentanyl laced in it. And so this is a major problem right now. And so our role is the data role, but we're also kind of working on the prevention side as well. So trying to get this message out to folks that we have a fentanyl problem in Cobb County.
Yeah, the Davis Direction Foundation tells me more than 30 overdoses in the last 3 months that are attributed to fentanyl. Is Narcan effective for that?
Yes. So Narcan will be effective to reverse the role, and so it's important that we try to get Narcan out. And if you have had a problem with drugs or know somebody in your family, it's important to try to get Narcan because it could save their life. So that's one thing, but also we're trying to do more testing for it. The state government has approved fentanyl strips that can be used without a prescription, and so we're waiting for more guidance on that. But that's important because maybe you can test to see if there's any fentanyl in anything that you are thinking about taking.